Everything was on fire, including us. The two options I had were either to lay down and die or walk out. That was an easy choice. I work for a pipeline company transporting hydrocarbons across multiple states. My position at the company was environmental specialist, and my responsibility was to assess environmental spills or releases and then determine the proper way to get them cleaned up.
That morning, I was getting ready, and just like any normal morning for work, and I remember Clay coming to tell me goodbye. And he tapped me on my left shoulder, and I remember turning, giving him a kiss goodbye and telling him I loved him.
I got a text from one of the field guys showing me what the spill was. I essentially had to call Clay and say, hey, I'm sorry I'm wrapped up here at the house. Would you mind going to respond to this?
I packed up my bag and I jumped in the work truck and I headed to the location, which was on the east side of Barksdale Air Force Base. I arrived near the location and met some field operations hands who had a side-by-side. Two of us, a coworker and I, rode the side-by-side to go inspect the release. I was under the impression that the site was secure. We had no reason to believe there was any danger associated with the site. As we approached the release, the last thing I remember was seeing liquid hydrocarbons on the ground. Had we known that was the case, we would certainly not have been riding a side-by-side through them. So no sooner than I noticed these liquids did we hear a loud whoosh. Everything was on fire, including us. I immediately jumped out the passenger side of the side-by-side and started running for something that wasn't on fire. Beating flames with my hands as I went, trying to smother the fire. As soon as I got to an area that wasn't on fire, I just immediately hit the ground and rolled and kept rolling until the flames were put out. I ended up in some thorn bushes laying on my back, just been screaming, God, no, not like this. I heard fire approaching, crackling through the grass, and that motivated me to get up. So I got up, I started walking, calling out for my coworker, who I eventually found. He was unable to walk. And so I began walking towards the road. I'm not sure how far I got, a couple of 100 feet, and then I saw a work truck with some of our employees coming towards us, so I stopped and waited. I don't really know what allowed me to get up and walk. I'm stubborn. I don't like to be defeated. I didn't have much choice. What else was I going to do? Well, the two options I had were either to lay down and die or walk out, and that was an easy choice.
I remember lifting and I just see this plume of smoke over towards the Barksdale's base. We understood that there were two patients. We understood that one was taken off scene, en route by ground. As I make my way, I can see that I'm fixing to deal with a severely burned patient. He was a very charred individual. It was very hard to discern any identifying human characteristics. Everything in my assessment is telling me that we have to go. There are life-saving measures that have to happen immediately. I think about it a lot. When you hear someone ask you to please help them because of the state that they're in, it's very heartfelt. you realize that you still have your job to do and you have to disassociate as much as you possibly can because that's the job at hand. LSU Ochsner here is a level 1 trauma center. They can handle pretty much everything. They have a burn unit. So we knew that that's where we would be heading back. We gave him an estimate of 90% body surface area burn. We were talking 3rd-degree burns. There was already gross blistering. There was skin already starting to slough off, hence me having to humeral head drill for an IV access. There was just no proper or normal body anatomy that is usually associated with burns. It was approximately 5 to 6 minute flight to landing at LSU. They had all hands on deck. They worked beautifully. We delivered Clay to Trauma Baby, gave our report off to the trauma team, and we gather our things and we get out of the way.
My phone vibrated because I always kept it on silent at work. I picked it up and I looked at it and I saw the name, which was one of Clay's coworkers, and I was like, well, that's weird. He never calls me. Why would he be calling me in the middle of my day? He said, Trisha, I need you to get to Ochsner, LSU. Clay is being airlifted because he's been in an accident. I knew he was serious and I just fell to the floor. I remember walking over to him and he looked like my husband. His face wasn't all wrapped up. I saw Clay. I just told him that I loved him and that I was never going to leave his side and we were going to get through it together.
His chances of death were basically at 100%. When we calculate out the formula to determine someone's survivability, it's the percentage of full-thickness burns, meaning 3rd-degree burns, in their age. When you add those up, you're well past 100% in Clay's case. My journey with Clay and his wife Tricia was basically a daily, if not multiple times a day, meeting with his wife as his proxy.
I did not leave the hospital. I believe it was the first 3 months.
The entire time he was there, basically he was going into the operating room 3 to 4 times a week, and that continued for the 4-month stay. The surgical procedures are to remove any and all dead tissue that were thermally injured, and then the fatty tissues beneath it oftentimes have poor blood supply, so all of that tissue has to be removed as well. He had such limited area to harvest skin from that we actually had to rely on a process of growing his own skin in a laboratory in order to achieve coverage. Artificial skin and all of the biological products that are out there are only temporary coverages for a wound. You ultimately have to have the patient's own skin placed. With his situation, there was such limited donor site, we relied almost 100% on growing skin and culture in order to be able to start planting these grafts. You know, a 50% burn, you can expect to be in the hospital 5 weeks, 60%, 6 weeks. But once you get to a 70 or 80% burn, the limited available donor sites then throw us into an exponential length of time of being in the hospital. Clay had lots and lots of infectious complications that resulted in pretty much every complication that I've ever seen in caring for burn patients in my 40-year career.
He was severely ill. He was on machines to keep his breathing. He was on mechanical ventilation. He was on medication to maintain his blood pressure. And he was on renal replacement therapy because his kidney at some point was shut down due to the illness and the severity of the infection. Definitely was a deadly infection. We reach that level, no treatment will work against this bacteria. Luckily, there was a phase 3 trial just finished a few months prior to that date, but wasn't FDA approved yet. That was the only hope remain at that point. Within a few days, we got the shipment of the medication and we started the treatment on that Saturday. It was like something changed within 24 hours, 36 hours, and we started having this glimmer of hope that Clay gonna make it.
These patients are fighting a tremendous battle, and the last thing people think about are the eyes. Any ocular burn patient who has burns to the eyelids, they're in a real risk zone as far as if nothing is done, they could lose vision. The first time I saw him, he had at least one suture in each eyelid. They always get worse before they get better, so he started to contract some. The sutures were holding for the most part. A couple times he would break them because patients is very irritating, so I actually had to redo a couple of his tarsorrhaphies. I think he got 3 in one eye and 2 in the other, which is, it's an awake procedure. We do it bedside. We do give them pain medication before. We do numb up the eyelids, before as well. But just the thought of someone sewing on your eyelids is not the most comfortable.
I remember the first time the physical therapist sat me up on the side of the bed.
And I was able to walk over to him and give him a kiss for the first time with him standing up facing me. And that was a big step of knowing that he was strong and that we were going to get through it.
I think it's a great day. And then the next big step was standing up. Could I stand up? When I realized how excited they were that I was able to stand for 1 or 2 minutes, I realized how bad a shape I had been in, how bad a shape I was still in. But seeing their happiness at my progress just doing something so simple, it gave me some hope that, hey, maybe I'm doing better than I should be. Maybe I can get back to what I used to be.
We were greeted by the Bossier Sheriff's Office around the Louisiana state line. They escorted us home the whole way. As we drove into our neighborhood, we had lots of friends and family on the side with posters and cheering and able to greet us on our way to our home.
Once I came home from Houston, I pretty much immediately began outpatient rehab.
When he came to us, he still had some wound care needs left, so that was why I was seeing him. He really had a lot of restrictions with some of his scar tissue that had already developed. Being able to fully bend his knees or his arm, and then strength issues as well, because he had been in a hospital setting and then in a rehab setting for quite a long time. So just building up that strength took a long time.
I still have some skin wounds that need attention. She helps me and keeps an eye on that to make sure that things are headed in the right direction.
There's no greater satisfaction. I was able to formulate a plan, the team was able to deliver, and everybody did everything that they were capable of doing in order to make this happen.
You have to be able to know that you did your best and you leave it on the field per se, and you're able to lay your head down at night, because there's always that next call, right?
I am so very thankful for this hospital. I love the people that cared for him. They don't know how much I love them for helping to care for him, but care for me and my family.
My life's changed for sure. I have daily struggles with mobility. I have daily struggles with heat tolerance. I get stronger every day. I gain more stamina. I'm not letting any of these limitations keep me from living life, but there are certainly limitations still. Tomorrow will come, right? The sun will rise on a new day and life goes on, and look for the best in it. Appreciate it because it can be taken away in an instant.